Welcome back to News Talk for this half hour. I'm joined by Dr. Stephen Cusin, patient advocate extraordinaire. I appreciate you coming in. You kind of came in a little last minute. I know we had some back and forth about what I wanted to talk about, what you wanted to talk about, and we ended up throwing it all out the window.
That's right. You wanted to talk about people taking too many pills. I wanted to talk about the cost of health care. My wife said boring. Annie said talk about Angelina Jolie.
Oh, she is in the headlines quite a bit now, and there's a lot of people on, I'm sure, both sides of the coin when it comes to what's going on with her currently.
Well, Annie's right, because Angelina Jolie did a great public service in talking about an admittedly rare mutation called BRCA1 or BRCA2. I'll call them BRCA, it's easier. Only 5% of women with breast cancer have BRCA mutations, and that means a tiny percentage of the general population do. But if you have the BRCA mutation, she had about an 80% chance of breast cancer and still has a 50% chance of ovarian. She'll probably go for the ovarian surgery after her next pregnancy. But no one would argue about preventive bilateral breast removal given her high risk. Although a lot of people, there are options. You don't have to do it. But it's a great public service for people to be aware of those high-risk groups. But there's a big difference in most people. Most women who get mastectomies of the healthy breast, 80% do it for no good medical reason, reasons that are absolutely not backed by science. And when guys talk about breast cancer, women kind of get a little creeped out about it. But the two most prominent breast surgeons in this country, Susan Love and Laura Esserman, agree. There's an epidemic of mastectomies that are not needed. Most women who develop breast cancer, and a huge number of them, have a type that 1/4 will go away on their own without doing anything, and 80% will never go anywhere. Now, no one would argue that these women should consider breast surgery. A lumpectomy is considered to be fine. A mastectomy is a shared decision, and that's fine too. But a huge number of them, 80%, opt for having the healthy breast removed when they have no particular risk. And a mastectomy is a big deal. And the reconstruction to a normal appearing breast is also a big deal. Now, Angelina Jolie, you can bet that she had a pretty good reconstruction. You can bet she had a very good reconstruction. Nipple conserving, probably not an implant. There are tissue reconstructive surgeries that most women don't get. They just get, the vast majority get a saline implant, and that's it. And there are better reconstructive surgeries. So they're risky. They should be embarked upon as a shared decision. Healthy breasts that have no particular risk should be considered to be watched carefully rather than to be removed as a reflex.
Is this one of those instances, and we talk about those a lot here, whereas if you have any kind of doubts or you get a result back from a test, to not only have an open discussion about it with your doctor, but to possibly go get a second and a third opinion before making the leap or the decision to go full out with them.
Yeah, I agree. I don't understand personally how, when 80% of mastectomies are considered to be unnecessary, why doctors actually perform them. So if you go to a Chinese restaurant, you're not going to find a BLT on the menu. And if you go to a breast surgeon and say, should I get my breast removed, especially when
they're going to say yes.
Especially when there's cancer in the other one. So yes, a second opinion is important, and sometimes an opinion from a non-surgeon, your own family doctor who may be in good control of the literature, going to a genetic specialist. Getting the BRCA gene test is $3,000, and most women are not going to do that. But if a woman has had a very prominent family history of breast or ovarian cancer or both, or even had one relative who got breast cancer at a very young age, those are the warning signs, and your doctor should be able to intervene and get insurance to cover that BRCA test.
All right, we're out of time. I say it all the time. I could talk to you for a whole other hour, so thank you very much for joining us.
Good seeing you.
We appreciate it.